Welcome back. Thrive Reproductive and Maternal Health Foundation will be hosting a virtual dialogue on cervical cancer prevention and control later today. To enlighten us more, I'm joined by Dr. Temptation Chigova, the Director of Thrive Reproductive and Maternal Health Foundation. Good morning, Doctor, and welcome to Good Morning, Namibia.
Good morning, Kodak, and good morning to all our viewers this morning.
Thank you. Now, briefly give us an overview of what is to be expected in this upcoming virtual dialogue on cervical cancer prevention and control that's taking place later today.
Yes, thank you so much. Today at 9 a.m., we are having a virtual dialogue which will be focusing on cervical cancer control in Namibia. We are looking at the efforts that the government and the partners have really put forward to make sure that we eliminate cervical cancer in Namibia. We are taking stock of where are we in terms of the progress. The WHO has set up an elimination strategy that looks at if countries achieve certain targets, they are able to eliminate the disease. And then we are looking at what can be done. And out of that, we are looking at coming out with a call for action, some commitments towards everyone contributing to see that women thrive and they do not get to suffer from the cervical cancer disease. So it's a dialogue which is involving the government of Namibia through the Ministry of Health officials. We have the Cancer Association of Namibia, which is also very pivotal regarding general cancer prevention in Namibia, including the cervical cancer. And we have got the community members, the academia is present to discuss on this matter of cervical cancer.
Now, you've spoken extensively about the stakeholders that will be present and so forth, but why did you see the need to host this engagement?
Great, thank you for that question. So firstly, cervical cancer is really causing a great loss to the country. We need to acknowledge that every year, annually, the statistics are showing that more than 203 women are lost to cervical cancer. How do I put this in layman's terms? That's almost like every 2 days we lose a woman to cervical cancer. And these are women that are in their prime ages, where they are breadwinners, where they have families and leave their families. So it becomes a very pivotal talk. And considering the cost that is involved in treatment, the impact of losing a woman, a mom, a sister, so it becomes a very pivotal talk. But why this time is because January is a globally international cervical cancer awareness month. And then yesterday, the 4th of February, you might remember it was also a global cancer day. So we thought at this particular time, we need to sit down collectively in our various sectors and really discuss about this disease. How do we come to an elimination phase? So this is the background where Thrive comes in and says, can we gather and sit on a table and take stock on what, where we are coming from, where we are and where we are going regarding cervical cancer.
Now, Dr. Chigova, talking about sitting down around the table, having discussions. Now, we know you're the moderator for this event. What are some of the topics the attendees can expect?
Okay, great. So earlier on, I mentioned that the WHO has set what we call a cervical cancer elimination strategy. So to set the scene, the WHO Namibia country office is going to present on what has been set. There are set targets that have been put to say if countries attain, there are 3 pillars basically. We have the vaccination. If we manage to vaccinate 90% of our girls, remember cervical cancer is caused by HPV. And if we do vaccinate our girls, we are going to contribute towards elimination. But it's a triple strategy where there are 3 aspects. We need to attain the vaccination, we need to screen 70% of eligible women, and we need to treat those who are found with the disease. So this strategy will be expounded on by the WHO because WHO has provided that guidance. And after that, when we have set that scene, we are going to have the panelists. Among our panelists, we have the specialist, gynecologist obstetrician, who is going to explain the clinical aspect of this disease, the screening, the importance of early diagnosis. We have the government through the Ministry of Health, the Reproductive Cancers Officer at the national level is going to explain all the efforts that the ministry is putting in place with it, the support of the development partners and the various stakeholders. And again, we have a radiation oncologist, Dr. Yambo, who is going to speak to us regarding the treatment, how difficult it is when women get screened late, the effects and all that, because she's a clinician and she meets that. And most importantly, we have the Cancer Association of Namibia on the table. They are an important stakeholder. They will also be bringing in the aspect of the role of CAN, the perspectives and the great work that they are doing. But on that also we are adding the youth voice. Afriyan is coming in to speak to fellow young people on accessing these services. And again, we have got a young lady, an adolescent who has been vaccinated for HPV, so who is also explaining to and calling for other young people to say, this is the right way. Can we, mothers, guardians, can we get the young girls vaccinated to protect them from cervical cancer? So the dialogue is around these. These are the panelists, and then we have the audience that includes various people from the communities and academia, as I've mentioned. And we hope to come out with clear understanding of what the strategy elimination is, and again, also some commitments. Call to action, everyone has got a role to play. It's not only the husbands have got a role to play to encourage women to be screened. That doesn't need money, because often when we look at call to actions, people think of, but where is the money? But again, we are saying at every level, when I withhold my child from vaccination, I'm not contributing to elimination. When I do not support screening, I'm not contributing. And again, when I, as a woman, I also do not attend the screening and utilize the services that are available, I still end up with cervical cancer. You know, coming back to the numbers, remember that number is very high, the 203. I sometimes explain and say, you know, a bus, a Marco Polo bus, it carries about 60 women. So basically every year in Namibia, we have 4 buses, Marco Polo buses, full, that women whom we are losing to a disease. So we can't afford, you know, to stay quiet. And I know the government and are doing a lot, but surely it's a dialogue that needs for us to review and say in Namibia, after breast cancer, cervical cancer is the second most common cancer-related mortality and morbidity, I mean diseases, and also the death. So that's what we focus on.
No, definitely. Now, when you put it into a perspective like that, when you made that analogy of how many people on the bus, it really makes the picture quite clear in one's mind. Now, there's so much out there, so much information about cervical cancer and so forth, but there's still stereotypes and myths. Can you tell us some of those stereotypes and myths?
Great, thank you. They really withhold women. So there are a number of myths and misconceptions around there. Firstly, from the HPV vaccine itself. Sometimes we get people not understanding what is it for, but we are here to clear out to say the HPV vaccine itself, it's safe and it's really for the protection of the girls. It has been tested and it works well, and like in Namibia, it's not for free, because there were people who were like, oh no, it's a free vaccine. The government of Namibia purchased these vaccines. They are safe for the use in our young people. So that relation also is there. And then in terms of the screening, we have myths of, no, if I get screened, I'll have infertility, I will not be able to have children. Those are all myths, and they are incorrect, and they are not facts. We have myths of people who have cervical cancer, only older people, which is incorrect. Our screening program is starting early 25 for the HIV negative, and again 30 for the HIV positive at 25, and 30 for the HIV negative. So what we are saying is that this can actually happen very early when people think, I'm not old, it's a disease for the old women. Those are myths and misconceptions. Some people say, no, it's for people who are promiscuous. No, that's not true, and it's incorrect information. So cervical cancer can happen to any woman, and that the screening is very painful. Those who have gone for screening, they got the test and they didn't experience that. In most cases, when I have worked in screening in the clinic, when I'm done, women are going like, oh, are you done?
Yes, what else?
What else? Because they will be anticipating the pain, but that's not it. So really the advice is, let's follow the Ministry of Health, what it's putting forward, and the stakeholders that are supporting together with the Ministry of Health, that let's get our children vaccinated, let's get screened. And if a woman gets the cervical cancer, there's also the myth of, no, it's witchcraft. And these also, you know, they lead to not accessing care, because you are thinking the treatment, then if it's witchcraft, then it doesn't have to be at the medical route. So that delays treatment. And sometimes you hear from the oncologist, by the time the woman goes there, I mean, it's too late, and we often lose these women because they would have gone round in the communities are assuming that it's witchcraft. That's a myth. We established that cervical cancer is caused by an HPV virus, the virus, so that's not witchcraft. It's not, you know, so that needs to be cleared so that people can access services that are available.
Thank you so much for your time. That's all we have time for. Thank you. And we wish you all the best with the conversations taking place.
Thank you so much, Kuda. Thank you, viewers.
Great.